I feel very privileged to be standing on this stage with some of these, really world leaders in obesity prevention as somebody who works in a very different system, actually, in the education system. So what I wanted to do today was first to start by acknowledging that we are meeting today on Wurundjeri land, which it always will be Wurundjeri land, and I do pay my respects to their elders, both past and present, and any who may be here today. So what I thought I'd do is start by telling you a little bit about our Department of Education, why actually it's such a good system, I guess, or to be interacting with the notion of obesity prevention. So in 2007, the Department of Education and the Office for Children, which traditionally sat in the old Department of Human Services here in Victoria, came together. And that was really to sort of exploit and to bring together the idea of a lifelong approach to learning, recognising the importance of early childhood as an important aspect of learning. But along with the Office for Children and the learning aspects in the kindergarten and early childhood education services, also came all the universal health services for children and young people. And that includes maternal and child health services, school nursing programs, and some allied health services for young people with children with additional needs. So as a result of that, we actually have a very large education system, but all the universal platforms for children and young people actually sit together in the one department. So we have a department that really represents the needs of children and young people at a universal level, which is the absolute perfect playground for prevention. So, that didn't go forward, sorry. So what I wanted to do today was really focus on the 5 game changers that I think have made this policy and this work so different to other work that I've been involved with in the past. The first is that the Healthy Together Victoria approach has fulfilled a policy need for both the Health Department but also for the Education and Early Childhood Development Department. So at the same time as the National Partnership Agreement on Preventive Health, which has funded Healthy Together Victoria, was being developed, there was also a big parliamentary inquiry here in Victoria looking at a focus on schools as a focus for healthy community living. And the recommendation that came out of that was to develop a whole health promoting framework for schools again. So what we were doing 10 years ago, we were now being asked to do again. But as a result, we realised that, recognising that the Healthy Together Victoria needed a focus on children's settings, as well as our parliamentary inquiry in DECD required a focus on children's settings, we brought those 2 pieces of work together with one product. The second, and it's been mentioned very many times today, is collaboration. When we put this, Shelley and I have been co-chairing the Healthy Children Initiative part of the Healthy Together Victoria approach. And what we did right up front was bring together a steering group of a whole lot of leaders across the community and across government departments in a range of different areas who may have some interest and some influence over the lives of children where they live, learn and work and play. So obviously DECD and Department of Health, but also Disability, Sports and Rec, Aboriginal Affairs. I didn't mention at the beginning, we have 3 education sectors. For those of you who are not from Victoria, here in Victoria, we have the government sector that we are, I guess, more responsible for, but also the independent schools and the Catholic education sector. And we had them at the table as well, recognising that this needs to be for all services, all education services in Victoria. We also brought to the table the Municipal Association of Victoria and the Office for Youth, trying to take a life course approach to children and young people. Shirley has already shown this slide, and I don't want to go into any detail, but just to show you the points of collaboration as they occurred. So clearly all the children's settings work we collaborated on very closely, but a lot of the statewide work that we have done, the Healthy Eating Advisory Service, the Achievement Program, the leadership work, the Healthy Together Exchange that we went to yesterday, a fabulous day, and I do congratulate all of you from the Healthy Together communities. The presentations you did yesterday morning were simply outstanding. But also the schools and the local early childhood services have been involved collaboratively in a range of different initiatives in the communities themselves. In terms of the central offices, I guess, and the work that we've been doing to plan Healthy Together Victoria, there's been a very strong working group, and what has worked differently, I guess, is that we've had policy officers from both departments working together on the ground, developing the achievement program, developing the products that are required for Healthy Together Victoria to be implemented. And so we've had a range of different people from different areas. So we've had curriculum at the table, we've had the student wellbeing people, we've had early childhood strategic policy people, we've had prevention and population health, we've had our, my team, and a shout out to my team who are just simply amazing. We've had Department of Health seconded a member of staff to us, and Claire Tobin, wherever you are, you should stand up and take a bow because the achievement program is would not be what it is without Claire. And as it's grown and development and been implemented, we've had a governance group that's shared between the two departments. So all the decision making around the Healthy Children Initiative has really been done, sort of collaboratively. The work that we do reports obviously from a line management perspective through the Department of Health, but also reports directly to a group of all the heads of department of the social policy departments in government. So we met last week with Shelley with the heads of Health, Education, Victoria Police, Department of Human Services, Justice, etc. So they're all, leadership all the way along has been collaborative from the very bottommost working groups all the way up to the heads of departments. The other sort of big issue why I think this is a game changer is that the Healthy Together Victoria approach provides a benefit to other functions of my department. So what we have been can I say so myself, I think we've been quite clever in organising, is the achievement program itself actually meets the needs of various educational policies as well. So many of you may not be aware, there's been a huge national push to promoting and improving the quality of early childhood services in Australia, also through a different national partnership agreement. And about 2 years ago, a new national quality framework for quality, for the quality in early childhood services was released, and there's quite significant regulation around that. And so the achievement program for early childhood services actually aligns very closely with the health and wellbeing components of those regulations. The school accountability framework that we currently are working on, and we're developing a new one as we speak, we're working very hard at the moment to align the benchmarks in the achievement program with the school accountability frameworks. We've worked very closely with the Victorian curriculum standards and also have managed to influence the Australian curriculum standards around health and physical education. And Claire is currently working with the school nursing program to make sure that the school nursing program and health promotion planning that the secondary school nurses do actually aligns with the benchmarks for the secondary school achievement program, which is due to be released imminently. And so what's happened is, as a result of that, is that schools and early childhood services are actually finding it very useful to sign up to the achievement program. So with no marketing, with no central marketing, I should say, because I know that all of you are doing a lot of it in your communities, with no central support, they're all signing up. And we now have a situation where we've got nearly half of all of early childhood services in Victoria signed up to the achievement program, and about a quarter of all schools. And clearly, as you can see with these numbers, there are significantly increased numbers signed up in the Healthy Together communities. So whatever you're doing in those Healthy Together communities, it's working. The other, as an old academic, I guess, now moved into the black world of policy, the thing that actually is an important game changer for me is that the policy and the research agendas are aligning so closely. So the achievement program is designed on very strong evidence, on a very strong evidence base, and that an expert consensus has been involved a whole way along. All the experts have been involved in developing those achievement benchmarks. So there's a lot of rigour in the work that actually underpins the community effort that we're making at the moment. And the other issue for me, which is actually an important one, is this notion that government is actually now an evidence generator. We're very good at talking about evidence-informed policy making, but actually we're the ones who are developing the evidence in a real-time way. And I think that's very new. And I acknowledge Shelley's leadership in this, because I think the establishment of the evaluation framework and CEIPS, the Centre for Excellence in Intervention and Prevention Science, is really going down a direction that perhaps governments have not been brave enough to go down before. And you will recognise David Davis in these photos. The fifth game changer and the final game changer for me is the level of, I've talked about collaboration right through this presentation, but there's also been very strong political collaboration across the state of Victoria. So Minister Davis, with his vision and his passion and support for Healthy Together Victoria, has done a lot of work in actually collaborating with his political colleagues to really help drive it in the communities, but also help the path for us in government do the work together and collaborate together. So the ministers who I report to, the Minister for Children and Early Childhood Development and the Minister for Education, have also been involved in some of the accolade sharing, have also been out there launching the programs in schools, and I think the ministers themselves also recognise that if this is going to work, they have to do the work that they do differently as well. So it's not just about me guarding my own things that work for me, but also sharing out the positives for them as well. And I just want to finish with sort of some basic acknowledgements. Shelley I've already acknowledged, and Claire as well. And but there's been a lot of people who've worked on these. These are just some of the people who've worked on them in recent times. But there's a lot, a lot of people are coming from all different parts of our department, different parts of the prevention and population health. And we will hopefully continue to do so with hopefully good results to show in the future. So thank you.
All right. There's been heaps of questions coming through all of this, so I'm just going to be able to pick out a few. Probably the most frequent one, I guess, is around the rest of Victoria. The other 75%, fundings for others. Is there any spillover happening already into other government areas? When's the rollout going to happen more widely?
When is it going to happen?
Yeah.
Great question. If I was in charge of the world, the rollout would be happening. So Healthy Together. So in the total construct of Healthy Together Victoria, around 50% of the investment goes into Healthy Together communities. Another 50%, we're talking about $120 million. So the remaining $60 million or so is for all of Victoria. And it's an important point because I think there's sometimes that's not clear, that there is a whole lot of infrastructure across the state, like the Achievement Program, which we think is the quality system for this effort, that everyone can have access to and support to. When it comes to the investment in these complex community level interventions, I think this government had to make one of the hardest decisions governments have to make. It's much easier for a government to make a decision to give everyone a little bit. It's much harder for a government to make a decision to concentrate an investment. And this government did that really on the advice and on the discussion, on the belief that we had to get a sense in this state of what it truly requires to invest in a prevention effort that will get us to a population health gain. And that's a tough decision. And I think at the moment we have this proof of concept underway. The signs are looking damn good. We love seeing what we're seeing. There is a powerful argument and narrative building for this to go further. Will it go further at the same level of investment? Not sure. Would I like it to go further with the same level of investment? Of course. But let's wait and see, because I think for too long we haven't had the power of the narrative nor the evidence of what can truly happen and what you can see and what you can feel that makes very good sense for further investment. But we know what's happening around the world, we know what's happening around the country, we know that it is a tough space to argue for more money, so we must be realistic. But to have a powerful case of smart investment, I think we're on track for that in Victoria.
Okay, thanks, Shelley. So Emma, you touched on this around the funding and sustainability of funding, and the local government still considering this external project type funding. So there are quite a few questions and issues around that, and cost shifting as well. So how do you see the track into sustainable funding that is considered part and parcel of local government work?
Goodness. Easy question. I think we need to demonstrate it through action and results, to be honest. I think the way, but I also think it's around continuing to remain relevant and to remain present. So it's a bit of a chicken and egg thing, but I think we need to demonstrate the success. We need to demonstrate that they can't live without us.
And just on that, a few questions coming through on workplaces. Is this a bridge too far? Is there actual evidence of effectiveness, sufficient evidence of effectiveness in workplaces to be including workplaces?
Do you want to go?
Yeah, you go.
Oh, absolutely there is. There's lots of them, and there's lots of evidence out there around on return on investment. There's some really sound evidence, I think, around how, for what you're spending, what you get in terms of absenteeism, staff turnover, culture, morale within workplaces. So I think there's definitely it's warranted, and there's definite room for us to make changes in those settings. It's just we're not as far advanced as in the other settings.
In fact, it's probably quite hard to make the argument about leaving them out because they are such an important part. So, Jenny, a couple of questions around DECD and around about the effort needed to sort of shift the focus wider than numeracy and literacy into the whole child. Was that a bit of a debate within DECD? And also some questions around monitoring and using schools as a setting for monitoring and the issues that might bring.
So to talk to the first point around broadening the scope of education broader than just literacy, numeracy. I wish I'd put our strategic plan up there because I'm so very proud of it, because we have 4 pillars, 4 outcome pillars, and one of them is wellbeing. So I think for the first time, the DECD is now recognising that the health education interface is just inextricably linked, and wellbeing is an important aspect and an important responsibility for the work that organisation actually is responsible for. So we are currently in the process of developing a health and wellbeing plan for the department, which involves everything from preventive things all the way through to dealing with children and young people with additional needs, obviously, and all the disability work that we do. But there is a very strong recognition that health and wellbeing is important, and it's currently being built into the accountability framework for principals and for schools as well. So, it's a long journey for a Department of Education to take, from a department in 2007 that was purely about literacy and numeracy to a department that is now about all learning, children and young people, and a broader holistic sense of children and young people. And all I can say is that, I have many, many more greys on my hair than I had 5 years ago when I started this job, but at least I have that one word that keeps me going in the strategic plan. To talk to the second point around monitoring, we've had a lot of discussions about that with the Department of Health and with Shelley in particular. The Department of Education and Early Childhood Development is responsible for monitoring the health and wellbeing, all outcomes for children and young people, and report through the State of Victoria's children regularly, and is legislated to report on outcomes for children and young people. And we haven't traditionally monitored height and weight past maternal and child health traditionally. So we are about to go out into the field next year with an adolescent health and wellbeing survey, where we will be surveying years 5, 8 and 11, which we do periodically. We do child health and wellbeing surveys, which we commission, and adolescent health and wellbeing surveys, which we commission. And we are in the process at the moment of advocating for and trying to get authority to include direct measurement in our survey when it goes out next year. Now, whether that will come to pass, we will try very hard and there's been conceptual support and intellectual support up to now, but we're just going through the process of finalising that. So watch this space, I guess, and then depending on what happens with that survey, we will then, look at the school entrant health questionnaire and look at the child health and wellbeing survey to also include direct measurement into that. So the department is constantly working to improve the way in which it collects data, so that data are more relevant, more useful, and more multi-purpose. And hopefully we will be able to find a mechanism to include direct measurement in those. So we're hoping to be able to include height and weight.
Okay. Thanks, Jenny. Just a final, an easy one for Shelley. On the political front, there's a couple of questions around the less prevention-friendly federal government, and that might be a bit of an issue, and also bipartisan support, because we have elections in this state as well, and what the risks those two things might hold.
How do you know? How do you know? I believe that a prevention effort will be as strong as it presents to be if we apply everything we have a vision for at a community level. You apply those same techniques, that same toolkit to what you need to do, certainly for someone like me at a state level. You build a force to be reckoned with. You build an initiative that is bigger than the individuals within it, and certainly a part of, but bigger than necessarily the government of the day. This is a population health intervention. Lesson 1, it needs to go for probably 8 to 10 years and change and reform and reformat if we're going to get population health gains. So I think it will be in the power of effect, that what we're showing, what we're seeing. What we haven't discussed in great depth, other than the child measurement, the multiple ways that this effort is not only being measured but has potential to be further researched. I think there's a very compelling story. I think the world is looking at each of the initiatives you've seen this morning. We're not doing these in closed-off laboratories. The world is looking and hoping that it will continue and thrive. But that's the jobs of people like me and a whole bunch of others, is to really create this as something that the state and the nation will need. And certainly our job now is to think about those issues at scale, even further scale, and how do we continue to build this momentum.
Okay, we're going to leave it there. So thanks very much to those 3 speakers. That was a fabulous set of presentations.